Welcome to the LifePro podcast, where today I have my buddy, Dr. Nissim, who is an accomplished chiropractor, but to me, he's a lot more. Roy, welcome to the show.
Thank you. Thanks for having me.
Why don't you start out by, telling everybody a little bit more about yourself, your journey, and, how you got here?
Perfect. So I'm a chiropractor for over 15 years. I graduated from the University of Arizona with a general biology degree and minors in chemistry and athletic coaching. Before I became a doctor, I wanted to be a coach, a basketball coach, but that didn't go well. So I attended chiropractic school and graduated in 2007 and did my continuing education in soft tissue and exercise rehabilitation. And today, I practice in Santa Monica and in Thousand Oaks, and I've practiced in about 6 different countries. So that's about it. And
Yeah, so I've been lucky to be a patient of yours, and I know that you're not the average chiropractor. Like, I know you have different techniques. First, I want to understand why you do what you do and why you became a chiropractor, and what you think like sets you apart from everybody else.
great. First of all, I enjoy just treating people and trying to help them. That's my main goal and priority. Um, but I noticed when I was in chiropractic school, my brother does soft tissue work, and I noticed that it's a lot more effective for certain ailments to work the tissue and not just manipulate the joint. But I also realized that you need to figure out how do you do things properly, how do you get to a problem faster and more efficient, and
Mm.
in addition to what else other than soft tissue the body needs. So first, I started learning about the exercise part of the body, like how to do corrective exercises, how the body functions and moves, um, while manipulate the tissue, and then also finally learning how to assess. And that what differentiates me from other doctors, I would say. How
Right.
I assess is different. It could be everyone. We line up the same people. We do the same assessment. I just see things a little differently,
Right.
and that could be just intuition.
So I've talked to a few different people that have had bad experiences with chiropractors, like that
Mm-hmm.
they've gone to a chiropractor and they've come out of it like worse off. How is your technique different than others?
Sometimes if the doctor did something he didn't assess probably something right, or he didn't expect something, usually that occurs when people have like a disc irritation
Mhm.
and people adjust that problem. So a lot of the herniated discs are L4, L5, L5S1, and people adjust that. So it irritates the disc even more.
Right.
So most chiropractors don't look at the fixated. Fixated means the joint is not moving right. They usually just adjust the generic stuff. And that's how I also, I train other chiropractors and physical therapists how to do some treatments and adjustments and soft tissue work.
Right.
So you really need to feel the body and have an understanding of what's not moving
Mm.
and then what's moving too much. And that's the problem. All these, especially a lot of chiropractors want to just hear the adjustment.
Mhm.
Sometimes you don't chase something that doesn't need to be moved. And it's all for oh, you heard the adjustment. Well, you didn't adjust the right thing. You moved a hypermobile joint, and that didn't solve the problem.
Got it. Now, a lot of people, I think most people probably come to see you when they're in pain. So can you talk a little bit more about maybe preventative care versus reactive care?
Yeah. So I do get a lot of people that see me for pain, but I usually get people that had chronic pain and they've been to everyone and they're like, "Well, I heard you do more complicated cases." So that's number one. So preventive care is what we should all be doing to take care of our bodies, right? We need to be more proactive and listen to our bodies when something is not feeling right, or so. But majority of the population in the U.S. is very reactive. So I have pain, it lingers, and then maybe I'll go ahead and see someone, and then sometimes too late, right?
Yeah.
So and the healthcare system also pays for reactive and not proactive. There's no such thing as preventive care. Insurance does not pay for preventive care, only for dental and your physical checkups. But for anything else, no. or women health.
Yeah.
So, so we're very reactive rather than being proactive about our bodies
And
or preventative.
that's pretty ridiculous that
Yeah, because
we're
that leads
trained.
to so many. Yeah, it's just our healthcare system. If you look at other parts of the world,
It's
more
not like
people are
that.
proactive. No, a lot of people are more proactive about their bodies and listen to it. Try to
Yeah.
not be sick.
Yeah. So, LifePro podcast is basically the manual to life. And what we're trying to do is educate people on things that, you know, I like to say we wish our parents had told us. We wish that there was an instruction manual. We wish that like somebody would educate us as we're growing. And that's what we're trying to do here. So today's topic is listening to our bodies. And I think that goes back to what we're talking about here is preventative care. And
Hmm.
just looking at the little subtle things that our bodies are telling us and making sure that we're taking care of them before they become major problems. So, what advice do you have for people listening to this podcast about listening to their bodies?
Well, I think first of all, if something is not feeling you right, like it could be like a body ache or something, just just feel it out. See what is your body trying to tell you. And I think that if, for instance, I feel that if we have these like aches and pains, majority of the people just ignore it, right? Instead of saying, well, I have something going on. Maybe I need to do something to my body to not have that feeling. It's just like having that check engine light, and you're going to just keep ignoring that light. And things can snowball really fast sometimes if we ignore it. So I think I feel that society lacks that intuition that we don't listen to our bodies, we just ignore it because of we're too busy. You know what? It's not something to worry about, but you don't know. You know, some people that have had aches in their stomach, they're like, "Oh, I've always had discomfort." That leads to pancreatic cancer sometimes, and that's how my father passed away. He always had stomach issues, and he ignored it for many months, and then he went to the doctor and they couldn't find something. And then one doctor found a little speck on an X-ray and said, "I think that's cancer." And
Yeah.
a year later, it's gone. So we really need to listen to our bodies, and I think we need to learn how to listen to our bodies.
Yeah. I mean, I remember when I had kidney stones, I started getting lower back pain. Um, I don't know if there's anything I could have done to prevent that, but it was like the early signs of something coming on. And I think that like uh going back to what you said about like pains and ignoring, like I've had lower back pain, as you know, uh for many years. And I've learned to like live with it. I know that I could exercise more. I know that I can, you know, um, lose some weight to help, reduce the strain on my back. And there's things that I can do, but eventually we learn to kind of ignore it and just live with it. So I think it's interesting to just not ignore it and do something about it. Whether it's to come see you or do the things that needs to be done to get over the pain. So you and I were just talking about that recently, and you gave me a staggering statistic about what percent of the population is dehydrated, and we looked it up. And well,
It's
actually,
like
you
about
told me that
75%. Yeah,
75%.
75%.
That's
It's huge.
insane. That's insane.
Three
So,
quarters of the population.
and so we can improve our health by just drinking more water.
Yeah, pretty much. If you think about it, everything can lead to better lifestyle, better feeling. Just feeling better is just being hydrated.
Yeah.
It's that important. The way they say you can't live is it's the power of three. I think it's three days without water,
Yeah.
3 weeks without food. So there
Yeah.
you go.
Yeah. That's how important it is. Water is more important than food. You heard it here.
Yep.
So,
All right, well, let me tell you this. Yeah, this. I mean, if you drink more water, you're less hungry.
yeah, absolutely. That's the key. If we drink more water, we'll lose more weight because it's
Exactly.
fills our stomach and it thinks that we're full, and a lot of that is mental. I've heard that at our age we don't really even need food. We don't need that much food. We just eat
No,
because it's of a habit.
yep,
It's our brains are telling us we're hungry. It's not. It's. I mean, our brains can control a lot.
yeah, yep,
Powerful. So it's pretty
yep.
interesting. Pretty interesting
It
stuff.
is.
So going back to pain, one thing that's always been interesting topic for me is like what's really the difference between pain and dysfunction? Can you talk a little bit more about that?
Yeah. So pain is the body signaling to you that there's a true problem, right? It's like the water boiled and now the steam is coming out. It's like
All right.
you're getting a signal that you got look into this further. Where dysfunction, there's no pain. It's just there's something not working well. I always talk about give this analogy of erectile dysfunction. Erectile dysfunction, men don't have pain in their penis. It just doesn't work.
Right.
Well, aren't you going to look into that? Yeah, but you have for men. That's if their penis don't work. They like it's like a real red. It's a red light signal. It's like, oh my
Big
god,
deal.
something's wrong. If your hip is not working, you're like, it doesn't hurt. It doesn't work.
Yeah.
But that can cascade through so many different things. And I think we need to realize that dysfunction is the way the body's telling you, hey, you have a flat tire per se, go fix this. It's like when you do have a flat, you're not going to keep right on that wheel because then you're really going to mess up. That's where the pain is, right?
Right.
So dysfunction is a way the body's telling you, look into this or else. So then
Right.
it's easier to fix dysfunction rather when you get to pain. Because when you get to pain, there's a lot of stuff now going on.
Yeah.
And to be honest with you, it actually will help people financially if they work on dysfunction rather than pain.
Yeah. Well, that's interesting because you and I have a mutual friend, and I won't mention names. And recently he told me that he can't lift his arm all the way. His shoulder is is messed up. Like he can't lift his arm. And I asked him if he got an MRI or got it checked out, and he said no. And it's funny because if he had an injury, he would know the cause of it and he'd go and get it checked out. But because it happened over time, progressively he got to a point of dysfunction. It he didn't think it was a reason to go out and get it checked out.
Yep. And
So
those are people that are like, okay, I can't lift my arm, fix it. Well, it progressively got worse. It's not going to fix overnight. It's even more expensive now.
right.
So that's where I think people don't really get dysfunction. And I always tell my patients this: do not wait to see me when you're in pain. Come in when you have dysfunction. Don't even have to see me. Go see someone else.
Right.
It's just work on the dysfunction, and that's where actually how I treat. So when people say I treat the source of the problem, I don't chase the pain. Well, a lot of doctors just chase the pain. They're like, my back hurts, so they just work the back. But when
Right.
you do a full assessment, it could be coming from something else that's causing that pain.
Yeah.
So once again, pain's an indicator something's wrong. Dysfunction shows me where to work.
Right. And I mean, do you need imaging to understand like where to focus on, or how are you able to
No,
isolate the
so I
problem?
so I do a lot of biomechanical movements. So movement patterns tell me a story. Imaging tells me what I don't see underneath the skin, right? So if you do have a herniated disc
Mm.
and you have back pain, okay, that tells me that there's a component of your body that's flared up. So let's not focus on that area. Let's look at something else. Even if you don't have an image, I can still figure that out, right? Unless you had a true trauma, like you land on your shoulder or you feel like you broke your hand, I would do imaging because then that's is it a sprain versus is it a fracture? And
Mm.
you always want to protect the bone first versus the tissue.
What is your opinion
So
of cortisone shots?
it has a place when the chemical portion of the pain exceeds at a certain point. So the brain will has all these neurons, right? And it has when it's under a lot of stress for a long time, no matter what you do externally, the brain thinks it's still like in pain. So you can get a proper treatment sometimes. So I will tell patients, go get a cortisone shot, calm the chemical portion of that pain, so therefore I can do my job better.
Yeah, that makes
So
sense.
everything I believe, like all like medications, uh, or my tools, everything's a tool. It's when to use the tool to help you then do what you need to do to get better. Because the
Right.
body, technically, the body, you're not like the cortisone or my treatments aren't healing it. It's tools and a way for the body to heal itself.
Yeah.
So that's how you guys see it. The body technically heals itself.
So going back to preventative care,
Mm-hmm.
obviously understanding the red flags in your body and all these and what your body's telling us and listening to our bodies, um, there's a place for that. But diet and fitness, I believe that that's like super huge. Do you feel that diet and fitness is equally important? Is there one that's more important than the other?
You know, it's like peas and carrots. They go hand in hand. You know,
Yeah.
so what? So you see people at the gym. They're always at the gym, and they don't look like they go to the gym. Is because what they put in their body doesn't help them. Sorry.
I'm one of those guys.
But also there's people that eat. So think about it. There's so many different like fads, right? So everyone's diet is should be specific for their needs. So let's say you're a vegetarian. So I treat a lot of vegetarian or vegans, and they're like, and they're heavy, but they're not eating meat, so their body doesn't produce protein, right? They don't make enough protein from all the foods they make. So you have to supplement so much to gain the muscle. But overall health, you need fitness and you need a proper diet. So quality food intake and a good fitness regimen helps benefit the body like overall. We saw that with COVID. You know, the people that are overweight or obese got hit hard with COVID and they did the worst. Where the people that were healthier, they were least likely to get sick or die. So that was that showed a lot that we need to really focus on our overall health. And that's, putting our heart a little bit on stress so it can learn how to, pump more blood, and then just make sure we eat quality food.
How often do we need to work out? Like what's
Everyone's different. Depends on what you want, but at least 3 days a week, you need to push a little bit. You
and
need to do some kind of like regimen that boosts your heart rate a little bit.
and 20 minutes enough?
Everyone's different. I don't believe 20 minutes. It depends how hard you're doing for 20 minutes. If you're in a high intensity workout, a true high intensity, 20 minutes is way more than enough.
Yeah.
But if you do a brisk walk, 20 minutes is not going to do anything.
Right. So ideally over an hour, hour and a half.
Well, no, it doesn't have to be that long either. It
Yeah.
just depends, right?
Yeah.
Like for instance, I need to work out X amount. It's my really time. I work out for a reason. I just want to. It's more aesthetic than to feel good. Then I do my cardio stuff. But if someone like my mom doesn't need to work out for an hour, someone in their 80s doesn't need to work out for an hour. But I think resistance training is important for everyone. It prevents osteoporosis, it increases protein synthesis, increases your natural testosterone levels, it brings up your better mood. It's something that you need for long term. And
Yeah.
I think people ignore how important resistance training is. They're like, oh, I like to run. And they are more prone to, osteoporosis when they get older.
And I think that listening to our bodies is exactly what we need to do when we're working out and our diets, right? Like
Yeah.
when you eat and you're not eating right, your body tells you you shouldn't have ate that. You don't feel good.
Yep.
And it's
Yep.
the same thing
100%.
with workout. When you work out properly, if you overextend yourself, your body tells you, hey, you did too much. If you don't do enough, you don't feel anything. So
Yep.
listening to our bodies will tell us, hey, I'm doing the right. And it sometimes it just takes time to ramp up. And obviously
Yeah.
you don't want to go 0 to 60 because bodies are at our age, maybe, can't take 0 to 60. But listening to our bodies and ramping up on our workouts and our diet, even our diets, I think I personally don't believe in crazy diets. I believe in a healthy lifestyle. Um,
That's why I hate the word diet. It's like when you
yeah,
think of diet, you think like, oh, I'm eating a specific way. It's no, you
right.
should eat non-processed foods and foods that don't put stress on your body. Now, look, everyone's different. I really highly recommend after the age of 35, you start getting a full gut analysis from stool, urine, and check the lining, see what your body is can't handle anymore. As we age, we can't. I can't have any spicy food anymore. It just
Yeah,
destroys my stomach. And I had spicy barbecue. I was like, oh, it's not that spicy. Like halfway eating, I'm like, oh, my gut was burning. It's
yeah,
just you need to listen to your body. And I think once again, like you said, we can't ignore it. At a certain point, you cannot ignore your body. You need to listen to it because it's telling you something is going on.
yeah. And so, this gut exam that you talk, is that something that's done by our doctors?
Yes, it depends. So most, if you go to a general practitioner, they don't think you need it. You don't have a problem, you don't need to look into it. So that's going back to the reactive mentality, right?
Right.
Modern doctors, like even just generic doctors, think reactive. Like I have a neighbor, she's a doctor, and she goes, I don't know why you take all these supplements or why you need to take your testosterone, and there's she doesn't read those type of research. She just reads the research like, oh, testosterone will give you cancer, or vitamins have no proof, there's no studies that does anything to you.
Mm,
Well, we know that vitamin deficiency is bad, like low vitamin D, will actually get your immunity. It won't help your immunity at all. A big boost. If you have lack of B12 in your body, you're more poor. You will have more nervous system problems. So certain things are important. But going back to modern medicine, so the doctors like functional medicine doctors, naturopaths, um, certain nurse practitioners that do like functional medicine. Those are the people that you would want to go see. They
yeah.
think outside the box.
So I saw a nutritionist, and we did blood tests, and I did genetic tests, and all these things that I did.
Mm,
And then she gave me supplements. So I literally take like 15, 20 pills every morning. Um,
mhm.
what is your thought on taking supplements, and also the difference between like oral supplements versus intravenous? Like, is there a difference in absorption?
Yeah, yeah. So intravenous skips the stomach, so you don't go through the digestive system. So it goes straight to the bloodstream, it goes straight to your cells. It's a lot better. Um, but it's not everyone can do an IV every day, right? We're not all Joe Rogan, but the general population should get everyone's dehydrated, right? So when you go to those IV clinics, most people don't realize they're getting some kind of vitamin, which a lot of them aren't potent to just get a minuscule amount, and they're really just getting hydrated. And after talking to one of these nurse practitioners, I realized that some people get not enough hydration. So men should get at least a liter because we're bigger,
Right.
and most women should get like 500 milliliters. It just depends on your body size. Now, if you're huge, you need more. So
Right.
I think we need to understand that's hydration. But when it comes to like vitamins, I think they're very important. It's a very good way to be preventative. Majority of society is vitamin D deficient, and we don't know why. Even those people that stay in the sun, the darker the skin, the less vitamin D you get absorbed. Um, I don't know why we're having issues with vitamin D, and I think just people are not just being more
Yeah.
indoor, but I don't know why we're not absorbing it through our skin as much. So I think that's a very important vitamin that everyone should take, and a B complex help
Yeah.
with the energy boost. But everyone should take some kind of vitamin, and they should test if they see if they have any deficiencies. My
Mm.
dad was vitamin D deficient, and they misdiagnosed him. They thought he had a urinary tract infection, whatever the long story short.
Yeah.
But he had a vitamin D deficiency. His body was all tired, and then when the minute they gave him a vitamin D shot, he thought he got steroids. He goes, "Oh my gosh, I have all this energy," because when you lack something, your
Yeah.
body is craving for it. So
Is
we need to
is
listen to the body.
is deficiency based on nutrition or genetic?
So I don't know. I've been reading a lot about genetics, and there's a lot of stuff going out there. Like genetics are a very small component of things. It's a lot of it's lifestyle and in diet. Some people, as we age, don't absorb the certain nutrients from food, so you need to supplement. That's why, like, I got a lot, and I still am vitamin D deficient, so I take a lot of vitamin D.
Mm.
Dr. Gundry is a good person to read up on. He says that we should take a lot more vitamin D than the recommended amount. And I forgot the numbers, but you can look that up. But
Right.
it's a large number. Let's put it that way. And as we age, we need more of nutrients and like protein and vitamins because our body it's just hard to process things.
Right.
So
So tell me more, like we talked about before about NAD plus, and I don't know a lot about it, but can you talk a little bit more about what that is and
so
benefits of it?
NAD, yeah. So I'm not an expert in it, and by no means. I've had it done multiple times. Technically, what it is part of the Krebs cycle. It's a coenzyme, like if I remember correctly, to produce ATP in the body, which your cells need for energy. ATP is very important for cells to help with repair and energy. What NAD, when you get it actually put into, as we age, it's harder to produce. So when you actually get it in your body, it's a cellular rejuvenator. Plus, it gives you all this. It just you feel younger. So it's like
Yeah.
it makes your cells young again.
So kind of like
So
fountain of youth.
youth, yeah, it's a cellular fountain of youth, pretty much.
That's amazing.
It's the only thing I can tell you that I felt. Well, let me say the only thing that injected though in the intravenously that you see immediate results and you feel when you turn it on and when you stop taking it, you literally feel it because it goes to areas where the body where it's highly vascular
Mm.
and where it needs most repair. So some people feel a lot in their face and the sinuses, a lot of people feel in their chest and their gut.
Mm.
So literally, you'll start to drip. You feel this burning sensation or sensation immediately, and then let's say you say I can't handle it. You just turn it off. You're like, wow, that's what's going on. So it's the one thing I say. This is the one thing you're actually going to feel.
And it
Everything
and it
else,
and it
go
helps
ahead.
it helps prevent injury.
It doesn't help prevent energy. It helps your body to rejuvenate itself better. It's
So
hard to prevent injuries. Anything can happen.
does it prevent illness?
It can help. It'll help keep you healthier. Let's put it that way.
And you
With
feel
your
better. You feel better.
oh,
So
huge difference.
what's preventing everybody from doing this?
Price.
Got it.
It's expensive. So once again, everything that's good is expensive
Right.
because it's not covered by insurance. There's a lot of studies on it, but not that many
Yeah.
because anyone can make it, and there's no hands on it or none I can think of. But it's a natural thing your body makes. You're just giving it more of it, and you're actually rejuvenating your
Right.
body.
So it's safe to use.
Safe to use.
It's expensive. And then what's the time commitment? How many
Well, how long is the session, or how many meetings?
yeah, how long is the session? How many sessions do you need until you feel different?
Right. So depending the potency, so there's a guy from South Carolina that's like the guru for NAD. He done many tests like through all these patients, and he tried over 1,000 milligrams. He tried less than 500, and he came to realize that 750 milligrams is like the sweet spot. Um, that dosage can take someone up to 3 hours to drip.
Wow.
It just everyone's pain tolerance is so different, right? So and it's in a bag. So if your pain tolerance is high, you can handle more. I know people that done 750, like my friend Dr. Sri, he does it in 6 minutes. It take about an hour and a half. It just depends. I've seen
pain threshold.
pain threshold. It's all about pain threshold and what you want to tolerate. And but it's afterwards you're it also is funny. Depending how your body how under stress it is, you either have more energy or you feel really tired because now it's rejuvenating your cells. Like after I did the last time I did it, I felt so tired. I took a nap. I woke up great, but it was so it. You're we don't realize how much stress we. Even if you're on my stressful person, everyone has stress. It's subconscious. It's how
Yeah.
you deal with stress, right? Um, some people are more vocal, some are more reactive, and some people just suppress it, right? So the body's always constantly under stress. It's always working. Now, to be efficient, you want to work to feel better. You want to make sure the body's working efficiently, and that's where we get in trouble. For efficiency is preventative, and preventative is expensive. It just adds up. Look at Kobe Bryant and LeBron James. They put
Yeah.
billions of dollars in their body, but they're making
They have all these
hundreds of
tools.
millions. Yeah, and they have a good team. And I think more people get educated on these things, the more they'll learn that how important it is. If you want to live long, there's a path. If
Yeah.
you want to live short, there's a path to that. There's a way to doing that too. It just all
Right.
depends what you want, right?
And
Everyone it has a choice.
well, I mean, the investment in our bodies is very valuable, obviously. And I think that if we do a better job taking care of ourselves, then, our rate of return obviously is unlimited, especially, professionals, and people that need to perform at high peak, so.
It's funny. We always talk about the the top producers, right? But if you look at just the general person that works at McDonald's, right? If he ate better and got the quality sleep and took care of his body better, he would actually produce better. And if we take care of our bodies better and our
Right.
livelihoods, it spreads out to the world. It affects multiple people. It's just I think we ignore. It doesn't matter your income. I think everyone ignores their body and don't realize how important to take care of your body will help not just you but the people next to you.
Right. And I think obviously, putting these investments drinking more water is a very low investment, but could help prevent, a lot of different things. And, NAD plus might be expensive, but also can prevent, major illness. So, can you really put a price tag on that?
No,
It's an
the easy
investment.
thing, the best thing just to start, just get hydrated.
Hydrated. Yeah.
And to be honest with you, there's just simple as just getting a bag with no vitamins in it is just get hydrated. It
Hydrated.
takes 20, just get 20
Yeah.
minutes to start the hydration.
Yeah.
So it's
And
all 20 minutes and you start getting the hydration process and just drink water.
yeah. Yeah. I'm definitely going to try to stay more hydrated, or, get IV, get some
Yeah.
hydration packs and try it out. Because I
Let
love to
me,
test it. I love to test it.
yeah. Let me ask you this part. It's what's funny. Some people are so dehydrated when they go for an IV, they can't even get the IV because their veins are collapsed.
Right.
So that tells you you're there for the hydration, but we can't even hydrate you because you're that dehydrated.
Yeah. Do people, not everybody knows that they're dehydrated. That's just their way of life.
Yeah.
They're always dehydrated.
The majority of people, when you think you drink enough water, you didn't drink enough.
Yeah. And what'd you say? Most people lie about the amount of water they drink?
Yeah.
So be true to yourself. Everybody listening, be true to yourself and listen to your bodies. So
Yeah.
we're coming down to the end of our podcast, and there's 3 questions that I ask all of my guests.
Mhm.
My question to you is, what would you like to teach? If you could teach one thing to the world based on all of your experience and all the expertise that you have, what would be the one thing that you would teach the world?
Listen to your body.
So the topic of our podcast, listen to your body.
Yeah.
Your body tells you the whole story. So
It does.
and I think whatever that means is, like, take a portion of your day, whether it's through meditation or just, even in the shower, just like really take some time and just think about how you feel and what's hurting, what are the red flags. and your body will tell you.
Or not even what's hurting, just what does it feel right?
Yeah,
What's not moving right? That's
right.
dysfunction, and that's why
Yeah,
he's telling you there's something going on.
yeah. What's not working right?
Yeah.
Next question. I do a lot of reading, Audible, so not really reading. I listen to a lot of books. I try to get through one book a week. That's my goal. And I think the most successful people in the world read a lot because they take everybody else's lifetime experience and they read it. And I think it's so powerful. So my question to you is, what's one book that you recommend to everybody that might have had the greatest influence on you?
I think in the business world, I think Good to Great by Jim Collins. The one part that really hits home was find the right person, put the right person on the right part of the bus. So I
Right,
think when people have a business, they try to find people that don't fit a certain role, and they
right.
force them there. Rather than if you put them in a proper role, they'll do better.
Yeah,
It's usually not most of the time it's not really the person, it's the role they're in, and
yeah.
it's not a good fit for them.
That's great. And my last question to you is, if somebody wants to get in touch with you, how do they do that?
Perfect. They can go on my website, drroynissim.com. They can go on my Instagram, that's Dr. Roy Nissim, or they can just email me, drroy@drroynissim.com.
That's great, Roy. Well, I had a lot of fun doing this. I learned a lot, and I hope you enjoyed it as much as I did. And I know that everybody listening had a lot to take away from this. So, I thank you for your time, and I will be seeing you soon, hopefully,
Yeah.
for
Thank you for having me.
preventative care.
That's right. Thank you so much for your time. Thanks for having me.
Thanks, Roy. Take care.